I'm Jackie Garlock. I'm with the Community Technical Assistance Center, and I'm delighted to welcome everyone to today's webinar, Emotional Distress in Adolescent Girls, Highlights from the 2023 CDC Report. Our presenter today is Dr. Tim Rice. Dr. Rice is a board-certified child, adolescent, and adult psychiatrist and psychoanalyst. He serves as the director of inpatient psychiatry at Mount Sinai's Morningside and West sites. I'm going to give Dr. Rice a chance to introduce himself, and then I'll give some admin things before we get started.
Yeah, I just want to say how nice it is to be here. It is such a nice community to see everybody typing in, saying hello, good morning, very happy to be part of it. This is the second presentation I've done with CTAC. I really want to thank the CTAC team for inviting me. The first one was on OCD, and it was a great time. I learned quite a lot preparing it, and I feel just the same with this presentation in that this is very new, recent data that I think can guide sort of an understanding of what I've been seeing for the last couple of years, and probably you all as well too. So I look forward to walking through this presentation with you all, and we'll hopefully have some time for Q&A at the end.
Fantastic. So just before I turn it back over to you to get started, I just want to take a moment to orient everyone so people know how to participate. So just so everyone knows, upon joining the webinar, you've been placed on mute. This helps us to sort of avoid any background noise. You can activate closed captions if you need to do so. There's a button on your toolbar that says live transcript, and you can select show subtitles. Any technical issues during today's webinar, you can please chat into it says CTAC admin. You can chat into our coordinator, Kiara, who will help you out. You also will have opportunities to submit questions. As Dr. Rice just said, we will have a Q&A at the end, so please use the chat box to submit any questions. There's that sort of dialogue bubble on the toolbar you can use. We will also have some time throughout the presentation to reflect, and we really hope that folks will share some of their own experiences using that chat box. I believe, there will also be a survey at the end, and so please make sure to fill that out at the end of the presentation. And then the recording and presentation for this webinar will be posted on our website, ctacny.org, within the next couple business days. So Dr. Rice, I'll turn it back over to you to get started.
Okay, thank you, Jackie. Thanks for a very nice introduction. So here's our title, Emotional Distress in Adolescent Girls, Highlights from the 2023 CDC Report. And here's our agenda. We're going to briefly review the developmental phases of adolescence. And then we're really going to focus on the stressors that young women today are facing. We're going to break it down into bullying, social media, electronic use, and feelings of belonging or not belonging. We'll talk about substance abuse, misuse, and as well abuse, sexuality and victimization, and safety concerns. And we will kind of wrap it all up by talking about what can we do to address these stressors and where to take things next from here. So I wanted to begin just throwing out a question. Are you all seeing an increase in psychological distress for young girls in your work? And if so, what are you all seeing in these young girls? Feel free just to kind of type anything into the chat to get us started. I've seen anxiety, eating disorder concerns, depression, increase in self-harm. Some people are saying yes, panic attacks, suicidal thoughts, anxiety, school avoidance, alcohol use. That's perfect. I mean, look at this. You guys clearly are similar to me, and that it's felt in many ways pretty significant, the increase in problems that people have been experiencing. Thanks for everybody who threw that in. Let's kind of go on to just what is adolescence. We're going to break it up into pre-adolescence, that's 9 to 11, early adolescence, 11 to 14, mid-adolescence, 14 to 17, and late adolescence, 17 to 21. And in these stages, young women have to navigate the challenges of puberty, menage, sexuality, and psychological independence. Pre-adolescence is prepubertal development. It's when children really begin to have expanding cognitive capabilities with formal operational thinking and the Piagetian stages. And what that can lead to is new capacities for mentalization. That is the ability to think about others, what their thoughts might be. And in early stages, it can be quite difficult for young men and young women in that they tend to overemphasize the importance of sort of themselves in potentially the world of others. This kind of egocentric tendency to make everything about oneself, when suddenly they can realize a bit better that others are having, their own thoughts. They think, is this person thinking about me? Am I getting judged in this? Do I fit in? These sorts of worries, when you're over typing in anxiety, can be very preoccupying for people and young women in particular at that early age. In early adolescence, 11 to 14, suddenly there are the physical changes of puberty that become very apparent. There's this reshuffling of friendships and peer hierarchies in the school. Sexual feelings can begin present, and that can be very exciting, but new and confusing, and may bring up a variety of feelings about having those thoughts. And gradually, young women and men begin to sort of distance themselves from the family, which allows them to be separate individuals and develop their own identities, but also makes them lose some of the protective capabilities that the family offered in terms of sheltering them from the challenges of the real world. By mid-adolescence, there is now an action orientation. Young women and young men who can often feel disempowered or threatened by some of the challenges they face can sort of go passive into active by doing rather than being victimized. And sometimes when that includes rule-breaking behavior like substance use or truancy, it can create significant problems for the young woman. At the same time, there's diminishing parental power. So even with all these actions, the parents have much less of a capability to navigate it. And that, size becomes an issue that the child you can generally hold if needed. An adolescent, that becomes much more challenging. And the ability to kind of go out into the world becomes more normative. And, young women at this age and young men are focusing on, relating to others in their own way that may often be different from the way that their parents relate. And that can cause some challenging of, sort of normal ways of engaging with the world. And with all this kind of engagement, there's more exposure to some of the problems in our society that we will see in the slide set. This 14 to 17, if you'll notice, is like pretty much high school, with potentially the exception of senior year. And the data we'll go over today is going to be a large national-wide survey of high school students. So we will be really focusing in on this. By late adolescence, there's sort of a quieting of some of that action orientation as young women and young men have a deepening of their love relationships, a consolidation of their own personal values and their sexual preferences, and individuation and identity formation in multiple domains takes place. Meaning by this point, there's hopefully, with sort of the absence of any significant pathology that can lead to challenges in working through this, but a greater, more coalesced sense of who I am, what do I want to do with my career, what do I want to do with my personal life, and things like that. So this is to say that, developmental progression roughly follows a relatively universal order, but development is certainly nonlinear, and it's characterized by individualized, unpredictable shifts, breakdowns, and reorganizations of multiple systems that are in interaction with one's own biological inheritance or endowment, and the environment as well. And mid-adolescence is uniquely exposed to environmental stressors at this time when distancing from the protective family increases, and the time, experience, and increasing cognitive and emotional capabilities for coping have not yet been attained. So that is to say that you may have the experience, as I have, of having a kid really struggle in their school age years, and early adolescence arises and things tend to become more controlled. And then suddenly there's a reorganization and a shift and a bad regression where problems kind of recur. And it's one of the sort of benefits of having long-term psychotherapy cases to kind of get to track and follow how young people navigate the different developmental pressures and challenges that they face through multiple ages. So I wanted to give that just kind of as an overview and now focus more on some empirical data. This starts to come from the Youth Risk Behavioral Survey, which is going to be our focus today. This report came out, I believe, in February by the CDC. And they surveyed high school students, men and women, and they asked, have you had poor mental health in the past year? And almost a third of students said yes, but notably more than twice the number of young women said so relative to young men. And we are going to focus in this presentation on how do we account for this, and we'll go forward by using the data of this survey to show what young women relative to men are endorsing as myriad stressors they're facing in their lives. So here is a question. Have you all felt sad or hopeless during the past year? You'll notice from 2011 to 2021, so the past decade, there's been, pretty significant raise amongst both men and women, but it is less pronounced for men relative to women. And if we are seeing that, almost 2/3 of young women are endorsing feeling hopeless, that is a sign that something is profoundly challenging for that population. When asked if they seriously considered attempting suicide in the past year, there is again a rise from 19% to 30% over the last decade. And if you look at the male rates, they're pretty stable. You'll also notice too, it's relatively stable for young women. And then in the last 2 years, and by the way, this survey is done every 2 years, and the most recent data was from 2021. That was published this past February. You'll see that like the raise kind of escalated in that period of time. And then when asked, have you made a suicide plan during the past year? Again, male rates are mostly stable, whereas female rates increase 15 to 24%. And again, we're kind of seeing a little bit of an escalation towards the recent past. Did you have a suicide attempt? So again, pretty stable for men, and again, raising somewhat for young women. And you'll notice with all these parameters, right, women are always significantly worse than young men. And the take home is depression, hopelessness, suicidal thoughts with a plan, and attempted suicide are all increased in females relative to male American high school students. And though young men die by suicide at higher rates than young women are clearly in distress, and the data shows this. They're much more likely to be having suicidal thoughts or making suicide attempts than young men. And this data, really enables us to kind of look at what might be causing some of these problems. So first, though, what do you all think? I mean, what have you seen in your practices that might be contributing to the increase in psychological distress for these mid-adolescent girls? I see COVID, I see bullying, I see social media. This is crazy. These are the exact topics we're going to talk about, so I couldn't be happier to see that. A lot of people saying social media, isolation, divorce, family ruptures, more social media, developmental disabilities, lack of female empowerment. That's great. Thank you all so much for typing this in, because we are going to cover probably the majority of this, and I'm excited to move on along with that. So here's the first topic, bullying, which somebody mentioned. Female American high school students are consistently more often the targets of both school and electronic bullying relative to their male peers. And by electronic bullying, I mean getting harassed on social media or being the victim of sort of communications that go through electronics. Here's some data from the CDC. At school, the rates actually declined 22 to 17%, still elevated relative to young men. But we might think, for those of you that mentioned COVID, which profoundly changed how education is provided in our country, how might the shift in the school environment to remote have impacted this data? And we will go on to see the electronic bullying rates rise significantly. But to speak about school, it's important to recall that the perpetrators of school bullying and the victims are both at an increased risk of suicidal thoughts and behaviors. And this is really common. This statistic really surprised me. Only about 23% endorse having not bullied someone in the last month. That's for young women. Young men, it's 15%. So basically everybody's bullying people. And I suppose that, it's important to keep in mind that bullying might not be so overt and, I'm going to hit you or I'm going to mess you up. It can be much more commonly sort of relational aggression, meaning, Sally's going to be, disappointed in you if you go ahead and do this, and kind of just sort of like navigating relationships and kind of pitting others against others and things like that. And in young women, that's much more common than it is in young men. It's the most common type of bullying for young women. So if you look at electronic bullying, and I think I misspoke earlier, it looks like this decreased slightly as well too. But the point I wanted to make with this is it's double the amounts of young men. And here I pointed out there wasn't a shift with the school environment to remote, but this is a pretty significant gap that we're going to end up exploring together. So in contrast to school bullying, female adolescents are much more commonly engaged in this than males. And for young women only, bullying and being bullied predict lower perceived and real peer acceptance, as well as lower perceptions of learning and school. New cognitive capabilities like self-reflection, attention to social nuances, and mentalization, like I briefly mentioned earlier in the developmental section, coupled with this like emerging, but not really yet quite there, sense of self as being kind of stable and able to withstand some insults and aggressions, is what makes young women and young men particularly susceptible to overvaluating social stimuli, meaning many adults, if you're bullied, it's easier for it to sort of roll off your back like duck on water, but with adolescents in particular, high school and middle school, it's much more difficult. And this adolescent egocentrism that I mentioned also makes sort of this pretty challenging. There have been studies, this study by Rice et al., that shows that young women are much more likely to have a focus on egocentrism in that age than young men. It's also important to keep in mind that bisexual and lesbian youth are more often the victims of bullying. And lesbian adolescents have the highest rates of everybody, both male and females. And an increase in bullying occurs even before the awareness or disclosure of sexual identity in the pre-adolescent years. Meaning, in the literature, they describe these proto-gay boys or proto-lesbian girls that they haven't really understood just quite yet what their sexual preference is, but some of their gender roles or their behaviors lead them to be targeted even before that kind of self-awareness or self-declaration, which can perpetuate victimization as years go on. So as with bullying among heterosexual women, these kind of bullying rates end up going down through the course of late adolescence. So it's really kind of those middle school years where this can be the most difficult, and the early high school years as well. And by the time you're late high school and into college, this is not as common a problem. But overall, in contrast to the data I showed earlier with relatively stable rates of school and electronic bullying, bullying of lesbian and gay adolescents is rising, with it going from 31% of lesbian and gay adolescents endorsing having been bullied to 44.5%. So in 2019, that's a pretty significant data, right? 1 in 2, or 1 in 50% almost of these teens are bullied. So what can we do to address bullying? We can think about prevention, identification, counseling, and advocacy. Prevention means, education to youth and the parents of youth of the consequences of bullying and ways to safely respond, with an emphasis on, best way to respond, and that sometimes by ignoring it, the problem can at first get a little bit worse, but then generally kind of goes away. Knowing how to seek help with it is very important, and helping the teen realize that they don't need to go through this alone. Talking with friends, talking with parents, and as needed, talking with school officials for awareness of kind of this pattern. And in truth, usually if one kid is being bullied, many other kids are being bullied as well too. Identification focuses on securing a safe space for youth to discuss bullying, screening for bullying, defining its type, like verbal, social, electronic, physical, etc. And I personally find that something that I really don't ask very often about in intakes or on meeting a kid. And I think it is a very important thing to ask, in that the data all show how tightly associated it is with suicidal thoughts and other risk behaviors that really are an important topic for us to address as mental health clinicians. Counseling details how to identify accepting and supportive adults, and support to parents of the kids who are bullied on how best to support their child, and how to also advocate with the school if the problem is really systematic and entrenched. And then advocacy oneself, just raising the awareness of bullying as a significant problem, particularly for sexual minority youth, and engagement with educational policy work. Advocacy can include just like what we're doing right now, bringing this topic to conversation and raising people's awareness of its importance. What might psychotherapy with young women look like in relation to bullying? So you want to raise self-esteem, build support networks, and those two things I think are so important to kind of just help resilience in that, as we saw, bullying is so present and common that probably at some point a kid will be bullied, and to make it not hurt them so much, just strengthening them, and both internally as well as relationally with the people that are their friends around it. And if a young woman is isolating or having difficulty really getting out and making friendships, just to help comment on that, I notice you don't have a best friend, and make that a topic of exploration in some of the psychotherapy, and that will ultimately make them more resilient. And talking about, specific bully counteracting strategies is really for young women and young men when it's a particular problem as well too. Education on what makes bullies bully. You can do role playing of, kind of helping the kid extract himself from a situation where they're being bullied, and going over sort of a toolkit made often collaboratively with the young person, just to kind of help them successfully identify, counteract, and report bullying. And again, a goal might be to reduce common but unproductive victim responses to bullying, meaning, if inadvertently a child is engaging in a way that encourages bullying or potentially makes the consequences of the bullying become unsafe, such as, escalating the situation rather than, trying to de-escalate it, that can be a very helpful approach. I think that Black and colleagues article talks about how common it is that the victims of bullying sort of make it worse rather than make it better with some of the natural responses that they have. So to sort of conclude this section, I wanted to ask you all, what strategies have you used to help young women with bullying? And have you all experienced any online sort of bullying? And has that been a topic of some of the psychotherapy that you all do? And Jackie's so lovely. I just realized I'm totally talking over the parts that I think you're going to be introducing. But
No, you
have
had
anything
it
to add?
handled. You had it
Okay.
handled. I just would love to hear, while folks are chatting in, what some of your experiences have been with the youth and families that you're working with directly.
Whitney Clausen says affirmations, positive self-talk, emotion expression, and communication skills to enhance self-advocacy. I agree so much. Corey Marsh says, talk about it, letting them know that you're listening and being caring. Whitney brings up social media time limits. Excellent. I think we'll talk about that a little bit in the next session. Angela Chirico says, helping girls to come up with a plan on how to address what's happening with school supports, and asking for help, commenting about trans youth and families, groups, clubs, exercise, therapy. I like that. This is a good one. Using Eddie's BIF method for dealing with conflict. Brief, informative, friendly, firm responses. Assertive-based nest strategies and mentoring programs. I think mentoring is so important. Making sure not only that a kid, has friends, but has a connection with a coach or a teacher or someone that can be a pivot away in many situations from the family, and preparing the kid to prepare for post high school life, helping them make connections with important mentors. And for those that may not have a father, often for young men, having that sort of presence of a male figure to look up for can be so important. So, all right, so let's move along, and we'll talk about electronics and feelings of belonging. So here is a question that was asked in the survey. Do you feel close to people at school? And most kids do, about 61% or 61%, but it's less so for young women than young men. And this is very important to me. Joyner's interpersonal theory of suicide talks about thwarted belongingness alongside perceived burdenness as like the two crucial interpersonal constructs which raise suicidal desire. So, what that means is if you have, going back, almost half of young women saying they don't really feel close to anybody at school, that's a problem in terms of them feeling connected, and a major risk factor for suicide. And this second little data point I think is really interesting, and this is reflected somewhat in what I see in the emergency rooms, the two hospitals where I work. Suicidal ideation amongst college students is actually highest during the summer, even when compared to times of academic demands like exam season and such. And the idea of that is when the campus clears out and kids are home, they're not as connected to these evolving peer networks that they've created. And that sort of sense of not fitting in or belonging to a community during that pause actually raises the demands even above, what it is when they're under a lot of stress for studying and things like that. So factors which contribute to young women's increased difficulty in finding the connection with their communities may contribute to the suicidal ideation increases that we saw at the beginning of the data presentation. So I wanted to focus on electronics and what role might sort of our increasing use of social media as a medium for engaging with others play in this. It's very common, and it is a nice paper by Odgers talks about sort of its interaction with adolescent development. For young women, harmful effects of increased electronic device acceptability and use as a means of connection extend beyond just bullying, like we discussed. In development, remember, there are these new cognitive capabilities of self-reflection, attention to social nuance, mentalization, and coupled with this, still emerging sense of self, just to kind of repeat this point, makes them very susceptible by putting too much attention on social media. And this formulation of adolescent egocentrism by Elkin includes a tendency towards self-preoccupation and hiding concern with what others think of one's appearance. And again, remember that young women are more prone to this than young men. So young women, the empirical data show, use social media much more than young men. And when they do use the internet, and the rates are just about the same, it's more often in games and kind of electronic sports and such with young men than social media use. And this difference changes the impact of, the hours that are spent using online material. So young women are not only more sensitive to these images because of this increased rates of egocentrism, but they're also more exposed to it since they are much more likely to be online on social media. So exposure to idealized images on social media, which could be the product of marketing, but it could also be the product of selective posting of their friends, raises dissatisfaction amongst adolescents and young women, with appearance comparison mediating the effect. Meaning, if you ask, what is it about these images that make things hard for you? The mediator is, well, I look at this and then I compare it with my own appearance or my own practices in life, and I realize I'm not always having a good time, or I'm too overweight, or I'm this, that, or whatever. And the consumption of all of these images takes a toll. Given that social media's portrayal of beauty standards and selective posting, social media may increase body image concerns amongst young women beyond just kind of dissatisfaction. And someone I recall mentioned eating disorders as something they were seeing more of. You can think about how this might interplay with some of these data. Certainly, it promotes insecurities and isolation rather than social connection. Now, if you look at social media use and emotional health overall, there are a lot of gaps in the literature, and it leads to some contradictory findings, whether, for example, social media use actually does cause depression, or may have no relationship, or may even be protective. However, overall, there does seem to be negative impacts, and they do seem to be sex specific, meaning women are negatively impacted more than men. So social media use associates with internalizing symptoms like depression and anxiety in early adolescent women, but not men. So again, a gender difference there, a sex difference. And similarly, social media use at age 10 associates with declines in well-being subsequently for female adolescents, but not for males. Meaning you ask kids at 10 what their social media use is like, only for women does it show that as time goes on, they are having declines in their emotional well-being. So why is this? Or here are two hypotheses just to think about social media. The displacement hypothesis by Kraut says that decreased connectedness through displacing time spent with friends to solitary internet activities like scrolling through social media feeds, as well as through the displacement of engagement with strong ties, such as close friends, to these kind of more superficial social networks and 400 friends that you're following and keeping tabs on your Facebook feed, is often what sort of, in this theory, takes away from having more substantial, close, maybe a dozen friendships, and instead it gets kind of diluted. This theory would say that social media use is a negative effect. But then in contrast, the stimulation hypothesis by Nolan actually says that this enriches relationships because you can learn more about the person, you can make new friendships through some of the people that you're friends with, and these are two competing things to keep in mind. Probably the answer to kind of the overall effect is that it's going to be dependent on the type of kid consuming the social media. And Winstone writes about how there might be a rich get richer and a poor get poorer effect. Meaning, if you're a kid and you have lots of friends and you are at the top of the pecking order, you may find that social media use ends up kind of further strengthening some of your self-evaluation through, all the people following you and such. But if and that would be, the rich getting richer, and the poor getting poorer might be if you're, a kid who has fewer friends and, for the very reasons we were describing earlier, sees, others having more successes online, that can lead to them feeling worse by getting on social media. And then interestingly, there's also the concept of a poor get richer sort of subset. And those might be kids that are perhaps so socially anxious that having real life friendships is almost difficult. So by having, the ability to use displacement, talking through avatars to other people in an online world, or engaging kind of indirectly through a game or some content like that, may help that group of young women. So for these young women with kind of hopelessness and depressive symptoms that might have weaker social networks to begin with, expanding cultural social media use may be a factor in the worsening of reported overall rates of worsened mental health, although select young women with other social symptoms like social phobia may benefit, as a recap. Okay, so what can we do for social media? Screen for and identify electronic bullying on social media, kind of going back to the bullying section, and provide, youth and their parents with some of the interventions that we described back then. But I think, more tailored to sort of belonging in social media directly, it's important to talk with teens about what is their social media presence and what are their experiences of it. I found that there is quite a lot that is usually not brought spontaneously into sessions, but will very quickly come up just by asking about, oh, tell me about your Instagram account. What do you post on that? What are your interests? And sometimes there can be a whole unfolding of a different aspect of a kid's life by whatever they're doing with their online world. if you find, as I often do, that a young woman or a young man is engaging in social media consumption in a way that is somewhat conflicted, meaning perhaps, a kid says, oh my God, I went to bed at midnight last night because, I was scrolling through my social media feed and I was aiming to do it for 20 minutes, but went on for an hour and a half. And then I started thinking about Susie, and Susie was so mean, and blah, blah, blah. It's helpful just to comment and mark that ambivalence, in the sense that they might be really interested in the content, and they might be interested in talking about the content and wanting to kind of engage you with their world through that content. But it's helpful to also point out, and yet you were aware that you lost 2 hours of sleep because of this, and yet you realize at the end of the day, you were just worrying more than you were before you engaged in it. And that worrying led you not sleep that well. And, wonder if you have thoughts about trying to limit this a little bit more. I think, in the same way, parent work is very important. That if a adolescent is having a lot of difficulty constraining it, you need to also speak with the parents too, just in the sense of maybe not such a directive, but certainly providing education on, generally this is what studies show is an appropriate amount of use, or maybe integrating it into, a behavioral plan at home, in terms of, meeting expectations first and then having access to the internet later for a select period of time. I think that can be very helpful even into adolescence, certainly with children, and just kind of letting them know, like, should you have a 9-year-old kid on social media? Probably a little too young. I think some websites have age restrictions, but maybe others don't. And having the kids say, you will be 15 when you get an account on this platform or whatever it is, I think it'd be a helpful thing to do with parents kind of preemptively. But I also just wanted to say that, like, in speaking with adolescents, I kind of jumped a bullet ahead here, going to this bullet of use concepts of normalization, universalization, and empathic validation, inserting the feelings promoted by social or prompted by social media. Like, just to say, this is actually quite normal to feel this way. A kid saying, oh, everybody's more popular than I am, just to kind of point out that not only is it normal, but everyone sort of feels that way. That's the universalization. And, giving them a little bit of empathy, and not, sometimes these things, to me at least, seem very distant from, what my own experiences or the experiences of my family might be. And, just to kind of show empathy and try to reach out to hear some of it, I think goes a long way, just in making a connection and working together on something that can be tackled constructively in therapeutic work. So, to conclude, if you think about the displacement hypothesis, that it might draw away from real life friendships, it's important to really mark and reinforce those in-person friendships when they exist in psychotherapy. Meaning, like, oh my God, you went out with Johnny to the game. That's amazing. Tell me about it. And oh, it sounds like you really enjoyed that. Just to sort of show interest and give some subtle positive reinforcement through showing select interest on things that you think are generally healthy, to kind of balance some of the troubles that might come up with social media. So I will take a pause and ask you all, do you get into some of these topics when you're working with young people? And what are some of the themes that you all have seen? And I'm opening my chat, and I see some people have been already adding some things, which is really helpful. But anyone just kind of throw at anything to go. Kelly Jeunesse talks about parents and their roles in this. Eva talks about, thinking about the things that have been taken away for kids, like, sports, clubs, lunchtime activities, very important. Corey talks about mentoring. He sees some of the struggles of belonging with that, and how Eva also says that bullying can escalate very quickly when it comes on social media. Diana says she doesn't see much of an escape from bullying, and yeah, I mean the data show that. Heather points out that it's correct. Social media can be terrible for teens, but it's pretty bad for adults as well too. And how this can sort of extend. If the home was a safe haven at one point that had some separateness from school or from work, social media makes it that everything is kind of all on top of each other, and you don't really get a little bit of a respite or a break from some of the worries. So yeah, maybe we'll move on with that. Okay, substance use, misuse, and abuse. So this data is like really impressive. Okay, in my training, and maybe in many of your training, it was always men use substances much more than women amongst teenagers. And you will see over the last decade, this changes. If you ask high school students, did you drink alcohol in the last 30 days? The rates are fortunately going down both for men and women, but now there's been an inversion. It was in 2011 almost the same, men slightly more. And remember, these are huge samples, so even like 1% or percentile makes is a large number. Now look at the split, 27 to 19%. This is vaping. 2015, so notice the shorter time interval. About a quarter men and women vape, but men more than women. And now there is an inversion, and that's a pretty significant difference, 21 to 15% with young women. Using cannabis, past 30 days, 18% of women are now saying that they have, whereas only 14% of men do. Look, 10 years ago, it was much more common for young men to be smoking than young women. So as somebody who works with very impaired adolescents and is a unit chief for 7 years on our inpatient child and adolescent unit, all the time I would see suicide attempts, suicidal thoughts, and the rest. And I became very interested in that topic. And one thing that is very commonly emphasized is what a major risk factor for both suicidal ideation and suicide attempts and those who die by suicide, substance use disorders are. And the hazard ratios range from 5.7 for those who have one suicide attempt to as high as 21.2 for those who end up having 3 or more suicide attempts. So to reduce suicidality, it is very important to reduce substance abuse and think about access. During the pandemic, a lot of people, for example, are prescribing stimulants to adults. Those levels raised significantly. And when those adults have, teenagers in the home, how often are they getting sort of used? But much more commonly and abused. Rates of alcohol consumption went up amongst adults during the pandemic, and when suddenly there's a lot more alcohol in the home, teenagers are getting into it and using it much more commonly. With the decreased restrictions on cannabis use in New York State and nationally, there is a lot more cannabis in homes, and that is leading young people to have more access to it. And there are quite significant data that there are major consequences of cannabis use, which we'll go into a little bit in teenage population relative to adults. So I think it's important as you think about what the impact of all this is on young women, that you have to think about social, personal, and psychological outcomes with use. And we will get into that. This is problem behavior theory by Jesser, and it is a person situation interactionist perspective. Now, what does that mean? It basically means each person's use is unique, and it might be different in terms of its outcome situationally, even over the time frame of a single individual. So, young woman starts smoking cannabis, and she may start accruing risk factors for suicide, for example, through, academic problems that arise from being intoxicated, legal complications that might occur from using in public, conflict with parents that might happen in the household, and an internal sense of guilt and anxiety that comes with the stigma of cannabis use. At the same time, though, many teenagers use substances as a way of getting distance from their parents or connecting with peers. And that very important separation individuation process often is the most fundamental developmental task that it needs to be achieved in the high school years, the second separation individuation, referencing the first in toddlerhood. What you can do, and I guess I'm stepping ahead a little bit to the recommendations, but to try to help an adolescent proceed down that very important path of individuating without needing to use substances as a kind of facilitator of it ends up being very important. And just to comment on the way that, what I found, with my own practice, many times kids don't even enjoy the substance use. It's more just like, oh yeah, everybody's meeting up in the park and we're going to smoke cannabis, and you ask about it. And, they say, I don't even really want to smoke, but that's the way that I'm going to end up seeing my friends or getting away from mom and dad or whatever it is. And, just commenting on that and helping sometimes whole peer networks think about other ways of creating a space for themselves. So next slide. Certain moderated use in certain secure contexts may actually progress adolescent development when considered this way. And this can explain that on a cohort level, high levels of substance use negatively impact adjustment. But adolescents who have never engaged in substance use are actually less well adjusted than those who minimally experiment. Meaning, heavy users are by far the most impaired, but a kid who experiments with this or that on a occasion or two may actually have more strength than the kid who feels so restricted that they don't find a way to do that. But does it mean you should encourage your patient to go use? No, not at all. But I think it's important just to think about like what the meaning of substance use is when we think about how to best intervene. So the use of behavior of every young woman is very unique, even over time and within the individual. And, the approach I try to show is to be non-judgmental and to show interest in particular about what is the meaning of their engaging in that behavior. What are they trying to accomplish with it? And if a kid says, oh, it feels good, it's actually often not the case at the beginning, right? The first sip of alcohol usually is not a very pleasant experience, or the first, drug use in general is usually marked by a lot of anxiety and trying it. And just to comment on that, I think as clinicians, one certainly has to make sure that teenagers are aware of some of the biological risks during this very sensitive neurodevelopmental period. And, that can include not only the static risk factors of cognitive impairment that comes with, both being intoxicated and post-intoxication states, some of the residual, cannabis, for example, but use and the increased risk of use with long-term addiction, psychosis risk with cannabis use, and some of the real risks of social problems or legal problems. like loss of friendships and being kicked out of school and getting into trouble with the law with illicits or underage use is very important to make sure that adolescents are aware of, because at their age, there is a feeling of, omnipotence or narcissism, and these things would never happen to me, and all the rest. Okay, I didn't have a moment to add in a let's chat here, but I would be interested if you guys have any sort of thoughts about all this. I'll share a little vignette that I like to share quite a bit, which is with remote therapy, the sort of increasing practice of seeing teens in their homes and how that interacted with substance use issues. Not one, but two of my patients, and perhaps you all have had more patients like this, will end up smoking right in front of me through the video camera. And it feels a little provocative and it feels a little shocking. And I've noticed with both, it is an opportunity to ask them, what do you think you're communicating to me by doing this? It's interesting because, when you meet people in person, it's generally not going to happen. But I think that the level of kind of casualness or comfort in their homes says something. And with one young person, it was actually quite sad. This young man had been kicked out of his high school for using in the classroom, and yet here he was using with an electronic cigarette in the therapy session, and he kind of said, "Look, I get so anxious, I can't. It's soothing. It really helps me." And yet it was such a destructive pattern that he had relocated to another high school and then was finding himself doing that in the high school again as well too. Another teenager had very different sort of meanings of that use. But I wonder, what have you guys seen? Open it up to the chat. People are saying they feel curious. Normalization of cannabis feels a little worrisome. What are the effects on development? Commenting how vaping has really been normalized. Kelly shares her 15-year-old daughter would prefer to use cannabis than be depressed and anxious or to take medications for those issues. And commenting just on sterile use, bathrooms. Bernally says, if you could answer Virginia's questions, it'd be appreciated. What about the normalization of cannabis use with states legalizing? I'm going to try to see if I can. I'm sorry, there's so many chat things. I'm missing things, I'm quite certain. But if the general topic is, impressions about what are the sort of implications of greater legalization in different states, I think it's a very political issue, and different people have different, feelings about it. I think it does seem like the trend is going to be legalization, and in particular, people who work with adolescents need to be prepared to engage in that, in thinking about access, thinking about seeing parents perhaps use and what are the implications of that. Parents who may be now more permissive with adolescent use, all these things that I think when increased access or legalization occurs, it's thought to be done in terms of some of the safety risks with adults, which are significantly less than the risks with adolescents. But that assumes that there's not going to be a spill down into adolescent populations of use. And I think, at least my own experience, is very common, and it's not very easy to prevent that kind of use in adolescent populations. Diana points out that Kelly says there is conflicting results in some of the neurological development in cannabis use. I'm not greatly familiar with the the nuances of the data with psychosis risk, for example. But I can tell you that my own clinical experience on the unit, there are so many adolescents who smoke cannabis, sometimes even for the very first time, and they come in completely altered to often our inpatient unit, meaning it's not just a short stay in the emergency room and it kind of fades, but it can sort of trigger something that may have already been developing to begin with, but nonetheless, like that's the event that causes, you know, in some occasions, kids that end up going to long-term inpatient settings like state hospitals and such. So I personally am very concerned about that. Someone also said something about you know, the dangers of street purchasing. Another very interesting thing I saw was at the start of the pandemic, when kids weren't going to school, kids who generally got their drugs from school peers or dealers that were sort of targeting high school populations were no longer getting that, and instead going to 125th Street or, you know, more dangerous kind of settings for kids. And sometimes those drugs were a lot stronger and a lot more, you know, dangerous than what perhaps would have been accessed through, you know, other high school students and such. So I thought that was a very interesting trend. All right, we have about 30 minutes, so I'm going to just proceed on through, and we can certainly go back to this. It seems like there's a pretty rich discussion going on in the chat. I appreciate everybody, everyone's engagement and attention. I want to talk just about sexuality and victimization. And you can see here, you know, 14% of young women today say that they've been forced to have sex. I mean, that's quite high. Males 4%, and quite steady. When you ask, have you experienced sexual violence by anyone in the past year, you'll see that you know, again, it's slightly increasing, but there's this really big gap between the men and women. So usually this occurs in late adolescence, meaning kind of the college years, or the very end of high school, and then declines through, you know, the early to mid 20s. Adolescents who have a history of sexual abuse in their childhoods are at a 5-fold risk of dating violence, and violence and sexual assaults, or being a victim of it, predicts suicide attempts in high school students, highlighting the importance of taking a sexual history in your socio-emotional health inquiries with the patient. Meaning that is a question that I don't think I've ever asked in my training, and I certainly now recognize you know, some of the error of that, just in terms of saying, you know, not only just do you have any history of abuse or neglect, but what's happened with when you've dated. You know, have you ever been put in a situation where you felt uncomfortable? I find, you know, because unfortunately there can be a lot of shame associated with that, it's usually not offered unless you directly ask about it, and it can be a very important aspect of the young person's life to learn. So do screening like I was just describing. Ask all of your new patients their histories in that area. And for those who have risk factors for being victimized, like people who have a history of childhood abuse, you may want to ask in detail about, well, I'm so sorry to hear about what happened, you know, when you were 7. It was over time. But to say, you know, tell me what's happening in the present. You know, what have you felt? You've been in a similar situation even as an adult, and to explore that. You know, other risk factors, just to point out quickly, are if you hear from a teenager, you know, the girl is 18, but the boy is 29. That is a risk factor for dating violence, and it is worth asking a bit about if everything has been safe in that relationship. And so too is the number of sexual partners that are endorsed as a risk factor for dating violence. So, screening and providing education and referral, if you are a pediatrician, for example, or a counselor in a school or whatever setting you work with, there is studies that show it's quite feasible. This was a study of nurse practitioners that were embedded, I think, in a primary care clinic or maybe a school. Just to, it's quite easy, or at the very least, you can often help young people get into care through a focus on concerns about dating violence. And I think, this is, I'm going to kind of loop it in the interest of time to matters of safety. When I talk about safety in this aspect of kind of ensuring the self is secure, thinking about broader things like firearms or some of the traumas we've seen in our communities in the recent past. If you ask teenagers, did you skip school because of safety concerns in the last month? About 1 in 10 girls say that they did. And I'm sure that is different for different communities, but that's a very high number. And again, it's higher amongst women than young men. It was even, about a decade ago. And you can think about, not only crime in the community and bullying and, other aspects like that, but also, these mass shootings that are publicized and the impact that can have on people who are fearful at baseline. So reducing school gun violence, just on a policy level, very important. Firearm restriction, thinking about, ourselves as New York City providers. I think it's relatively low rates of firearm ownership here, but it changes very quickly as soon as you leave the city. And I think if you look across the country, there are quite a lot of guns, and with more guns, it means more teenagers having access to guns, but also just the culture of safety, I think, can feel a little bit more strained. So after major publicized shootings, I think it's really important to, here I wrote students, but even if you think about your own patients, just to ask them, if that was on their minds. I usually find that people don't bring up events like that, and it's not because it doesn't affect them, but rather, maybe they're just not asked, or maybe there's other concerns, and finding out just about, what their reflections were, what their thoughts were, how they're left feeling, I think is really important. And again, this kind of intersects with the bullying comment, because and the importance of like increasing friendships, and also increasing, if you're doing any school consulting, just the cohesion of classes. There is a youth activism toolkit by Advocates for Youth that sort of empowers teenagers to become active around matters like school shootings. And if you think about encouraging in a productive way, sort of transition from a passive, victimized role of someone who could be shot to someone who is actively engaging with the content in a way that helps them understand and define their views, can be very important. So what can we do to address all of these stressors? Here's a summary. This Youth Risk Behavior Survey, the Summary and Trends Report for the last decade, and that should be 2023, apologies, gives a wealth of data pertaining to young women's well-being today in mid-adolescence, as well as the data that show comparison with their well-being from former years. Think about, again, depression, hopelessness, suicidal thoughts with plan, and suicide attempts. They're all higher more recently. And I think what's really wonderful about this survey is not only are you seeing these increased rates of sort of emotional unwell-being, but you're also seeing rates in young women that are showing more impact of generally negative social occurrences like bullying, drug use, social media use, and feeling disconnected from peers, and matters like sexual victimization and school safety concerns. So we need to be mindful of this. Adolescence is such a crucial time for separation from the childhood family and entry into the peer community. In many ways, it's sort of the foundation of adulthood. And in addition to these developmental differences between young men and young women that have been written at in the family separation process in particular, young women have a much greater difficulty relative to young men in opening themselves to available peers. We know that from the developmental data for various reasons. And it can be a greater sense of self-protection because of some of the violences that they've experienced, as well as a more kind of guardedness in their capability to sort of open themselves to others. And to be aware that that developmental process can be skewed is very important. So to advance this kind of developmental task in young women, we have to meet these societal trends which are impinging upon the process. And this might proceed not only through direct work with young women to strengthen their resilience and skills, but also to engage with society and provide advocacy for young women, and even just raise awareness of it as we are doing today. So to integrate this data, the developmental perspective has been used to illustrate the process through which these factors produce the challenges observed and experienced with young women in adolescence in the communities, consulting rooms, emergency departments, inpatient psychiatric units, and other treatment settings where we all work today. And intervention with young women in these areas of importance is a pathway to improved emotional well-being in years to come. Just to recap specific intervention, think about prevention, identification. I hope as a product of this webinar, you all will ask some of the patients you see today, what about, social media use or sexual victimization, things like that. Provide your counseling focused on some of these issues. If you ask about it, you'll learn about it, and be prepared to sort of provide support and advice with it. Talk about the harmful effects of social media and the reasons why women may be more susceptible to it. Talk about how much more common it is, even in the last 10 years, for young women to be using drugs than young men. Think about sexuality and victimization. Think about ensuring safety in the schools, and asking in particular about young people's feelings and thoughts about safety in their schools. And finally, intervention. Looks like I repeated myself. Look at that. And as said, these slides will be up on the internet. So I tried to insert little references throughout it. If you want the full ones, you will find them there at the end. So let's talk. We have about 15 minutes, exactly on time. I can't believe it. I'm very proud of that. Do these data match your experience, and do these proposals offer a starting place for solutions? I want to hear what you think. Chat in your questions. I see some people have their hands raised, but I actually can't see who that is, and I'll maybe ask Miss Jackie's help with that. And,
yeah, I know that there's one person that has their hand raised. It might be easier if you just put your question in the chat. And that way we can share it that way. We don't have the ability to unmute folks in this format of Zoom. So appreciate everything that folks are offering. It seems like folks have some really great questions. Feels like people have been really engaged in this. One person was asking that they, as a parent wanting to support, in this case, a 15-year-old, but someone, who's having pretty intense symptoms and might be even thinking about hospital, the need for hospitalization. So how might you, talk to a parent who's trying to decide, do I need to get sort of a higher level of care for my child?
Yeah, I think families struggle so much with how hard it is to access services. I think you call a clinic and they're closed for intakes, but in 6 months maybe there'll be an opening, and I think it's incredibly hard. And parents who are seeking help are often not able to receive it. So I think encouraging early intervention is very important, like to help parents understand that, you might think that, Susie's problems aren't that significant just yet, and maybe they're not, but I really encourage you explore psychotherapy for your daughter, because it may be some time until you're able to access it. And it can be very helpful, even if this problem is temporary, just to talk through some of the challenges of development that most likely every adolescent will struggle with in some ways. And for patients who are in care, and if there's a sense that things need to escalate, like suicidal thoughts and such, I think it's very important just to help families understand that they're actually quite common, right? Like, think about our data. What percentage of young people are endorsing suicidal thoughts in the last 30 days with this data set? And because we know it's so common, people should be asking about it. If parents see their kid is in the bedroom crying every day, and maybe they're aware that there's been some cutting and things like that, you'd be surprised, I think, how often it's not talked about. Like, are you really struggling so much that you're thinking of ending your life? So I think just basic guidance can be very helpful. I guess a lot of it depends on kind of what setting you're in. But for those of you that are outpatient providers, knowing how to access emergency rooms, I think, is very helpful. Like, where are they? What are some phone numbers or some addresses you can give parents? Or, if needed, educating the parents. Don't feel inhibited to call 911 if you're in the state of a crisis in the home and need to be brought in, and things like that. And things like that as well too. I could probably talk forever on that topic, but I see there's other stuff coming in and I don't want to ignore it.
Yeah, no, thank you. That
Maybe,
was incredibly helpful.
oh, thanks, Jackie. Maybe, Jackie, I'll let you kind of pick and choose things to
Yeah,
talk about.
and we're not going to be able to get to everybody's questions, but I'm trying to sort of look for some themes that have been coming up. It feels like there was a lot of folks that during our social media section, that were sort of coming in with some nostalgia for days where, young people did not have to deal with the sort of needs of the stressors of social media. And I remember I know you mentioned that the Surgeon General recently shared that 13 is too young for children to be on social media platforms. I'm wondering how you've engaged with families who are trying to make the decision about potentially limiting their child's social media use, and in particular, sort of how they navigate those limits. And I'm particularly also, about talking about it taking away social media as a punishment as well, sort of that aspect of it.
Yeah, very good. Almost where my mind goes is the sort of same theme of the last response. Like, early intervention, I think, is very helpful, to kind of help a parent give their child notice, like, when you are 13, we will allow you to have a media account showing us, responsible use and the privileges that you will get before then, so that, it's hopefully very clear to the kid what the expectations of the family is. And I think you will definitely have kids that say, "Oh my God, it's not fair." Jen in my fifth grade class, she already has Instagram or whatever it is, or Snapchat or whatever. And how to kind of help families provide security in their own beliefs and structure for the households, and how to help the kid, sort of mobilize, like, I guess, some empathy with the kids. I wish I could, but I can't. This is a agreement that you've had for many years, and we're standing to it. Things like that, just to sort of help weather their storms. And I think ultimately, when kids do have these kind of struggles, a lot of times it's not even really about the thing they want, but rather a sort of a challenge to potentially even be reassured that their parent does remain in control, in the sense that it can feel very desettling and destabilizing to have a tantrum that leads to a parent giving in. The kid can become very fearful of, well, God, if I can get away with this, like, what other things I can get away with? And sometimes, the thoughts on a kid's mind aren't always such, great things. So I think helping parents stand firm and follow the available evidence, the Surgeon General warning is a great, example. I think I didn't actually even include in this, and I'm glad that you brought it up, of just, know what the data shows and then try to follow it as much as you can. I think the same could be said for, cannabis use. If it's a rule in your home that there's not going to be, any smoking, then stand to it. Oh yeah, but it's not fair. I was over at my friend's house and her parents were smoking pot. Well, that's not our family, and just to kind of help in that way.
Yeah, I think that's important. There was a lot of questions, I think, around cannabis use as well. And I think that's a great way of talking to families about how they can set limits and how they can make sort of those decisions as caregivers, and then create strategies for communicating that to a young person in a way that is both firm and loving.
Well said.
Yeah.
Yeah, that makes me think of the authoritarian, authoritative, permissive parenting strategy, right? So if you give a parent or a kid sort of the permission to do whatever they want, that's actually pretty difficult for the young kid's development. Similarly, if you're authoritarian, you say this is the way it is, and you're not kind about it, that doesn't do well. But if you set appropriate limits and you're also warm and loving as you do it, those kids are actually the ones that do the best. So that was a great thing to bring up, Jackie. Thank you. And
normalizing, I think that what you're getting also is normalizing that it's okay to be disappointed or to feel like that this isn't fair. And also, like, that's an okay feeling to have while not giving in, while still maintaining a limit. I think that's like all that lovingness that you were just speaking to. I'm wondering if you could speak a little bit to some of the gender differences that are mentioned here. I know that some folks were mentioning that there's data on males being more likely to drop out of high school, less likely to complete college, and wondering sort of how that, some of the differences or the factors that impact the differences of young, the impact, increasing with young women, but maybe staying stable or decreasing with young men.
Yeah, I think things that are on the rise. I mean, I think that the presentation and recap had quite a bit. I'm really struck by the substance use, to be honest. I think that's a really striking difference in a very short period of time to see, what to me was always taught is male adolescents are at much greater risk. Now it's sometimes like a significant difference between young men and young women. So, I think keeping in mind that, like, as you work with kids over years, as some of you may, you might ask about alcohol use when they're 14 and get a no, and then now they're 16 and you haven't asked about it in 2 years. I mean, I think that's an error, that to kind of keep in mind that if such a high proportion of teens just in the community are using, you really need to be asking young women those things, and no longer is it just guys that are kind of the ones that you think of as being at risk. And another data point that comes to mind is just the victimization. Like only 4% of males are in victimized roles, but a much higher percentage of women are. You got to think about that in working with your female adolescent patients, and including, sadly, I hate to say this, but like, on our inpatient population, you're often having, 12-year-olds, 11-year-olds, that kind of pre-adolescents even, reporting, a lot of victimization, sexual violence and such. So I think sometimes we gloss over sexual history questions with kids that have not yet matured, but like in society, it's not uncommon, I think, for middle schoolers and even early middle schoolers to be engaging in exploring one another's bodies and often getting into situations where people feel uncomfortable, and it's important to talk about all that.
Yeah, I was thinking about not even just social media, but also just having access to phones, work with young people who, come in distressed because, seventh graders who have texted their, seventh grade boyfriend a picture of them naked and now don't know what to do about it.
That's right. That's a great example. That's right. That's so common, I think, unfortunately.
Yeah. Yeah. I'm looking at the questions. I'm wondering, I know you spoke to how different young people of different sexual orientations can have greater levels of difficulty. I'm wondering how the report accounts for sort of trans or gender non-conforming or non-binary youth, if it gives specific data on that, or if those are sort of grouped in with the larger sort of gender groups.
You know what? That's an excellent question, and I was so glad. I think Diana had shared the link to the full youth risk behavior survey results. I encourage you guys to go look directly at the whole thing because there are data in there that I didn't include, and some of it is just as interesting and just as easily could have made it into this presentation. I think if I remember, the increase in adolescents who are gender nonconforming or transgender has risen so recently that I think that data was not included back in 2011 or 2013 or 2015. I think they did ask a question for the first time in this most recent sampling about gender, but that was something that I definitely encourage you guys to go look at directly if you're interested, because I don't quite remember what the question was phrased as or what it was about. But certainly, if your practice is anything like mine or the inpatient unit where I've worked for many years, it is much more important a topic, even the last 2 years than it was in the last 10. So thanks for asking.
Fantastic. Well, thank you so much, Dr. Rice. This was incredibly helpful. I apologize for those folks who we didn't get a chance to answer their questions. But please, if you have any outstanding questions that you think a future offering could speak to, either with Dr. Rice or with other presenters, please put that in your survey at the end, because that can really help us to think about how we inform future offerings. So I just want to give everyone some information on some upcoming offerings that we have. We have a lot of offerings the rest of this month. So we have an offering that is celebrating Asian American Pacific Islander Heritage Month, and it's going to be a panel called Expanding the Narrative, Healing During Asian Pacific American Heritage Month and Beyond. We also have an offering on facilitating support groups for youth peer advocate. At the end of the month, we have an offering on the trauma of weight stigma and fat phobia. It talks about how bias can show up in clinical spaces with youth. And then we also have one on June 1st on trauma responsive telehealth for children and adolescents. And that is one offering that we were going to be offering CEs for. So thank you everyone so much. Please, again, remember to fill out your survey at the end. And I think that is it for today. Thank you all so much. Thank you, Dr. Rice, and hope to see everybody at a future offering.
Thank you so much, Ms. Jackie. I also really want to thank the audience. It's really loving to see these kind words of thanks and gratitude. So, thank you all for being here at the time to do it. And I hope to see you all again.
Yep. Thank you all so much.